Hi, my name is Tiffany Urban with Nurse 383, performing my musculoskeletal assessment. This is my husband Travis. He is going to be my mock patient for today. First thing I do will be to perform my hand hygiene and also perform my general assessment, looking for appropriate dress, actions, etc. And then the next thing I will do is I will start with my shoulder assessment. I'm looking for symmetry of the shoulders, make sure there's nothing abnormal that way, and I will also palpate. We'll start with palpating too. I would do it on both sides. I'm just trying to make you see on the video here. We'll do the one side, we'll palpate the shoulder, and we will also palpate the elbow, and we will palpate the joints here. And of course, like I said, we would do this bilaterally. We are looking for any deformities, pain, anything unusual there. Then we will start with range of motions, and we'll do arms. First, we'll have you make a big circle up and out, and then we will have you come back around. Good, and then we will adduct here and abduct. We'll also have you reach both hands behind you, kind of hard with the chair, and then up and around here. Great. Next, we will be strength. So I will have you put your hands up at me, please, and then pull against me, and then push. Great. Out and in. Perfect. And then we will assess the wrist. So you go palms up again, push again. Great. And then range of motion of the wrist this way as well. Perfect. Then we will do the fingers. You can have both your hands out, and don't let me close them for me. And now close your fingers for me. Good. And don't let me open. Great. And then this is all. If we have normal strength here, it is a +5 for normal strength. Then we will assess our pulses. I'm going to assess the radial pulse down here. Of course, we will do this bilaterally. I'll maybe do it on this hand so you can see me better. We'll also check for brachial pulse up here. And then we will check for trochlear nose, which is on the elbow on the inside of the arm. And then we will move on, and again, of course, we will do this all bilaterally. Then we will move on to the lower extremities. I hope you can see okay on the video over there. But we are going to check for skin discoloration, specifically noting the color of the skin, looking for vascular or arterial discoloration. We will also check for pitting edema. Down here, we'll push our thumb in on the foot for 10 seconds, and if it stays there, then we can call that pitting edema. We would also do strength. I will have you, let me back up. We need to do pulses. So we'll check down here for pulses. We'll do posterior tibialis, dorsalis pedis, which is the front of the foot. And then we will also do the popliteal pulse, which is behind the knee. Again, we will do this bilaterally. And then we will check on range of motion of the knee and strength. If you could put your legs out for me, please, both of them out and back down. Good, and then try and push your legs out and pull them back down. Great. We would also, at this point, if we'd have the patient supine, we would check for hips, but we will do that in our abdominal assessment when we have the patient supine. The next thing that we will do, we'll have the patient stand up, please. I'm going to stand over here with legs together. I will have you bend down and up again, down and up again. Perfect. And then we'll have you lean side to side. Rotate your torso. And then we will have the patient bend over and touch their toes. At the same time, I'm also checking for spinal alignment, anything that's issue here. And then we will have you stand back up again and then lean back for me. Great. And that is what we're looking for, the musculoskeletal assessment. At this time, I perform the hand hygiene, and we are done with our musculoskeletal assessment. Thank you.